Hello, everybody. Dr. Goforth here again from Cornerstone Physical Therapy. I am one of the pelvic health specialists here at our Woodfin location. Today, we're going to be talking about briefly exercising with incontinence. First of all, do you know what incontinence refers to? This just means leakage of either urine or fecal matter when you don't want to. It's not really supposed to leak at any given point in time unless you're intentionally sitting on the toilet or standing to urinate or have a bowel movement. So, number one, if you're having some type of incontinence, hopefully you've seen your medical provider. And then number two, I hope that you've seen a pelvic health specialist like myself. If you're in the area, come check us out, because there are different reasons why that incontinence or leakage might be happening. And one reason is some either incoordination, tightness, and most common, weakness and lack of endurance in your pelvic floor muscles. And these are muscles that are inside the pelvis. All the red are muscles on the outside as well. So their two main jobs are to prevent incontinence and your organs that they contain on top or hold on top from shifting around or dropping down. So getting right into exercising with leakage. So number one, hopefully you've seen someone about that. The reason, too, is if you've seen a pelvic health specialist, they're going to be starting you likely on what are called Kegels or Kegels, however you want to say it. And they're going to give you an individualized assessment and homework and things to think about when you are trying to exercise based off what they find with you specifically and depending on what your preferred form of exercise is. So on that note, with exercise, one of the things that I tell my patients, make sure you're breathing with exercise. Seems like a really silly thing to say and really simple, but most of us have caught ourselves at some point holding our breath with exercise, whether we're so focused on what we're doing, maybe the movement's a little more complex or new, or, just our cardio is not up to par and we're not breathing as well as we should and just need to adjust to that. But when we hold our breath, that increases the intra-abdominal pressure, and that pressure has to go somewhere. It's going to go to the weakest link. If you have pelvic floor weakness, it's going to go down to your pelvic floor, bladder, rectum. It's going to make you more likely to have leakage. So some people, they don't have leakage at rest. It's with jumping, running, things like that, those higher impact exercise activities. So definitely go get checked out and breathe. Another thing that I noted, as I mentioned earlier, again, once you get assessed, your pelvic PT is going to be giving you some tips and things to think about during exercise. We already mentioned breathing, but also incorporating your Kegels with exercise. So, for example, on bridges or squats, I often will have my patients do a Kegel coming up out of the squat or as you lift into a bridge, if you know what those are, just for some examples. So they're going to give you some things to think about just like that. And the last thing I have written down to mention is if you're having leakage at rest with walking, gentle exercise, don't jump right into, no pun intended, higher impact activities like jumping, like running on hard surfaces, like mountain biking where you're really jolting your body and your bladder, those pelvic floor muscles. You want to fully resolve as much as you can, preferably totally get rid of that leakage at rest with gentle exercise before you go into those higher impact activities, because it's just that much harder for your pelvic floor to work and you're more likely to experience that uncomfortable leakage or incontinence. So hopefully that makes sense. If you have any comments or questions, please put them in the comments below and we will get back to you. Have a great day and stay tuned for next time.